You can do this real easy. Is right where the end of her brow is. I use my little finger and just kind of like latch into that gently as if you're pressing the weight of a nickel, and then you come up. So you're just pretty much, I should probably do it on you all, is what I should do, so you'll know how it feels. Why don't you sit here first, Mom, in the chair? She didn't like my cold hands, I betcha.
Here, see, I'm doing it too, Victoria.
Yeah, watch Mama what we're doing.
Mama's doing it too, okay, girl? Okay.
So you just kind of lean back into me like that. Okay. So I come down here to the bottom of the brow where you just got a little bitty ridge. And I hook into that. And I'm just lifting it straight out from where it is. No more pressure than that. But I'm bringing it this way. And that helps take a lot of pressure off of the nerve centers. So that's one thing I'm doing. And you can hold that for seconds. You can hold it for a few minutes. Usually when I first do this, I feel resistance. Like I feel her brow trying to pull back like it's attached to a rubber band. So you feel that at first, but if you continue to hold, and it's not that you're pulling more or anything, you're just holding it out slightly, you'll feel like this sensation of like a giving, like taffy being pulled and not going back. You know, the rubber band is like trying to pull you back. But when you get the release, it feels like, and it's just ever so slight, but that's where you get the real benefit, is like when you feel the resistance. And if you feel like some resistance, rather than bring it out more, you kind of back up a little bit, and it kind of like gets used to what you're getting ready to do. And the thing that I find is the more that you do it, your body really expects and anticipates it, and you get your release much quicker. So like when I have somebody come and do cranial work the very first time ever, it may take, very like a few minutes before you get that release feeling. But when they come back the next time, it's like their body's like anticipating, and it just like releases. And so a lot of times I can, after somebody's used to having it several times, I can get the whole session done in half the time because their body just lets go. See what I'm doing to Mama? I'm just very gentle. So are you feeling any kind of thing, Mom? It might be different if you were laying down.
Yeah, I think it would.
But you feel the pressure that
I do.
Okay. So that's the one that's important. And everything is bringing away. You're not ever pressing in. Another very important one is right here by the temples. And there's a variety of things that you do here. And this affects the sphenoid bone, which is kind of like a bat wing shaped bone that goes through one side all the way to the other. And the first thing I usually do is I come out, just like I did with the brow. And it's no more pressure than that. And then you can go from side to side. Do you feel me doing that?
Yes.
It's ever so slight. And that helps kind of, you have your pineal gland rests in the center of that, and that kind of helps get things juicy with that pineal gland. Gets fresh endorphins and stuff coming out. Okay, so we got side to side, we go up, and then you go one side up and one side down. And you switch the other side, one side up and one side down. And it doesn't matter what order you do that in, and then come back out again. So that is really a very beneficial spot to work on. And I'll do this on you too, Sarah, so you can kind of see what it feels like. And then another one is like, kind of hook your small fingers in at the side of the jaw, and bring it out. Kind of down and out a little bit. And the more you have this done to you, most people, they kind of just go into this zone where they get so relaxed, sometimes they'll fall asleep immediately. And it's also, you know, good before bedtime thing to do too, just to help relax. I need to put my mask in, I realize I don't have it on now.
Do you need one?
And then this, I brought it with me, I'll go get it before I work on inventory. You take the ears and just kind of give them a little tug. In fact, you can use a little more pressure on the ears than you would any other part. Go down. You can do one side up and one side down. And, you know, let this take a few minutes because this one helps bring things away from the nerve centers too.
And the vagus nerve, you work on that as well?
Well, not particularly the vagus nerve. I'm sure it's probably affected just with everything that you do though. So anyway, it's pretty much as simple as that.
Okay, there's
And-
tissues right here.
Tissue. I don't know, I've got a creepy side here. I'm gonna get my mask down in her face.
Hi, beautiful.
Mm.
See, I did it first.